you. I actually want to pick up right there because I think for me, what I had hoped this report would show us is more collaboration, sort of where you highlighted that there are still gaps in the multi-system coordination, especially for some of these young people with complex care needs. And it's on us to break down those silos, not the young people who are accessing these services. They're the ones who suffer if we don't figure out how to make those partnerships work better. And DCFS, DMH, DHS, DEO, LASA, HI, and our housing providers, we all have to work together in order to serve our young people properly and make sure they're getting housed and cared for, and that they're connected to the mental health programs that we're expecting, as well as the career pathways they deserve. We've heard from foster youth who participated in our program earlier this year, some of the challenges that they personally have faced, even when they had vouchers in hand, ready to access housing. And just this past Saturday, a couple days ago, I met with our youth commission, who hosted a listening session in my district, and their experiences align with that, and what is in this report, that our young people really need more from us. And so it's on us to answer that call and center them in the experience. And I think what I'm most frustrated by, I think each department's report glowingly shows what you are doing, perhaps in your own lane, but what is absent is how we are centering, actually connecting with the young people to deliver those services in a meaningful way. I understand that the DCFS behavioral health position that was referenced in response to an earlier question is not being funded in supplemental, and it's critical, from what you're explaining, to making sure that we actually have somebody in that position to do the work. And so I appreciate that we have good answers for some of the questions, but we also have to implement that change in order to actually meet the moment for our young people. And I'm glad that we were able to avoid some of the proposed cuts at the state level. But again, it doesn't mean anything if we don't actually spend that funding and make sure that we're fully spending it. And I would rather us be going back to the state asking for more, because I know when I spoke with some of the legislators in my district, they were of the impression that there was a historic, ongoing underspend in these programs. And when we're going up there saying this is critical, we can't hear back that we're not spending money fast enough in order to serve our young people. So basic data, I think, should be the starting point for a report like this. And I wasn't able to tell how many beds are exclusively available for our DCFS youth who are exiting care. I don't know how many young people the supportive housing division served. And so, some of those data points are really how, what the metrics of success that we're looking for. We have to be outcome oriented in how we're telling the story of our work, not just what is the process, but how are we actually delivering meaningful results. So can you tell me how many young people are exiting the system in need of housing supports?
I can tell you this month there are 62 youth that are going to exit, and right now, all but one, as of 3 weeks ago, had an identified housing plan. That one was just waiting.